I'm Carmen Terzic, the chair of the Department of Physical Medicine Rehabilitation, and we are now in Orlando, Florida, in the AAPMR meeting, national meeting, and it's for us a pleasure and a huge honor to have visiting our booth Dr. Walter Frontera, which is one of the physical medicine rehabilitation physicians that have given to the specialty huge contribution, not only national but international, in different aspects of our practice, in research, in the education, the academic, and in the clinical. So for us, it's really an honor to have you with us. And Dr. Frontera, welcome here to our booth. And we would like to talk with you. What do you see are the challenges and the opportunities that our practice, our specialty have in the future with all the innovation, the change in the healthcare practice? So what is your opinion?
Well, thank you very much. Thank you very much for the opportunity, and thanks for the kind introduction. It's a pleasure to be here with you today, visiting your fantastic Mayo Clinic booth. I would say that our specialty has, at this point in time, more opportunities than difficulties. This is a great time for PM&R, and I say that for different reasons. I think it should be obvious to the observers that the number of people who may benefit from services in a PM&R setting is increasing significantly. And like all of us know, this may be due to the fact that people survive acute illness and injury because of the advances in medicine, but also because of the aging of the population. And I think we all know that with advancing age, we tend to become a little bit less dependent on others. We lose functional capacity, and that is precisely why physical medicine and rehabilitation can make a contribution. So I think in the future we should expect more people having the need for PM&R services. From a scientific point of view, I think this is a wonderful time for the specialty. I think we can take advantage of the fantastic advances that we have seen in science and medicine in general over the last 50 years, including changes in the genetics and genomics area, changes in stem cell research, new technologies that have become available for the different patients with different disabilities. So I think that we are in a very good position to be contributors to the scientific research that may eventually lead to new therapies and new treatments for disability.
Yeah, I agree. Right. And now that you mentioned about the research part, which you have, as I said before, a huge contribution, and also directly by your research in muscle and aging, but also through the journal. So can you talk a little bit about the journal, as you are the editor-in-chief of the journal?
Of course, I am the editor-in-chief of the American Journal of Physical Medicine and Rehabilitation. And in 2012, we will celebrate the 90th anniversary of the journal, which is a fantastic milestone. The journal started in 1922 as the American Journal of Occupational Therapy, and it has evolved over the last 90 years into one of the best journals in the field, both nationally and internationally. A very exciting time for the journal because in addition to the evolution of the content, because we publish now articles on robotics and a lot of the biomedical literature that is coming out related to rehabilitation, clinical trials that are being conducted. In addition to the changes in content, we're now delivering that content to the reader in different formats. In fact, early 2012, we're going to launch the app for the iPad version of the American Journal. So the reader, the authors, the readers, the reviewers will have the content available in different formats right there. For example, during the rounds with the residents, the lectures with the medical students, and the interviews with the patients. So I think this is a fantastic achievement, and it will make the content again available to the reader and to the interested individuals in different locations immediately.
That is amazing. So this is wonderful. And we thank you for this innovation in the journal. And I would like to ask you last question. And it's about what will be your advice that you will give to the new generation of PM&R physician now in this time?
I think there's a lot of things that new physicians can do and have to do. One of them is never lose sight of the main vision and objective of our field, of what we do. I think in spite of the fact that we have to adapt to the changes in the economy and the healthcare system, we should never lose sight of the reason why our specialty exists. The second thing is that, as has been said by others, we have to develop this interest in continuous learning. We have to make sure that we maintain our knowledge and skills up to date. And we should always attend, for example, meetings like this, and make sure that we explore the new areas and avenues for the specialty. There's a lot of things that young physicians have to do, but I think those two are quite important from my point of view.
Well, thank you very much for being with
pleasure.
us. It's really a pleasure for us, an honor, as I said before.
Thank you very much.